another case that we had in our office, the patient actually just came in because they knew that we did a lot of soft tissue. They wanted it adjusted. They had been going to a chiropractor and getting adjusted, but they just wanted a little bit more. They actually didn't come to our office because of a specific extremity type pain. They came to our office because they had a little bit of low back, a little bit of neck pain. As soon as they kind of saw that we were a little bit different, it happens often, patients will start, well, what about this complaint? What about this complaint? And it's not even the initial thing that they came into our office for. So this patient had a knee replacement. And a lot of people are thinking, like, you treated a patient with a knee replacement, and it is a little funky and a little weird, but this person wants to eventually be able to run again. They had a lot of traumatic stuff go on with this right knee that actually caused them to have like 3 or 4 surgeries, and at a fairly young age for a knee replacement. Now, because of this knee replacement, it looked like running was kind of out of the picture for this person, but they are really passionate about running. So they complain about not having full range of motion, having just kind of weakness in that knee. So we do a little evaluation, and we always check joint range of motion, even on a replaced knee. This person had very limited knee extension, or his ability to straighten the leg, and actually had pain when we flexed the leg and pain when we had them contract their quad. So we tested all those things, and I see that they're just limited in that knee extension. And you're thinking, it's a knee replacement, there shouldn't be limited joint range of motion. Well, the brain still has power and control over the muscles and the ligaments and tendons that are in that whole joint system. And if the knee or the brain does not feel comfortable moving in certain directions, it's still going to limit some of that range of motion, and it's actually going to dampen some of our stability and our control. So we take that knee, we extend it very passively, probably 20, 30 times. And I kind of get a little aggressive with a knee because it's a big joint. And I knew this knee replacement had been healed for many years, so it wasn't something that we were worried about affecting the actual prosthetic of the knee. So we take it, we extend it, probably like 30 to 40 times just in office. We do the same test. His flexion range of motion opens up. His knee extension changes a little bit, but he doesn't have the pain anymore. We do a single leg squat test. He's actually a little bit stronger, has a little bit more control. And a lot of people are going, how moving a joint replaced knee, how is that gonna reduce all of this? Well, if you watched our shoulder video, we talked about how the brain has a ton of control over our joints and ligaments because of what we have in mechanoreceptors and proprioception of joints in space. And if it's not able to fully extend, basically the brain just starting to dampen its ability to receive information from it, but also give out good control. So we extend that knee, we are starting to reduce the pain, we're starting to improve the range of motion. So it doesn't just stop there. So then the knee, we always say, is like this joint that just gets beat up in the middle of 2 mobile joints, or should be mobile joints, right? So your ankle is a joint system that should move and have a lot of range of motion. If it's limited, or it doesn't have very much control, that knee has to, if it's limited, the knee has to make up for some of that range of motion and move side to side when it's really only supposed to be a joint that goes in this motion. And then the hip, same thing. If the hip is really tight and limited, the knee is going to try to carry some of the burden of the range of motion. And then on the stability side, you have a bunch of muscles that control this going in that one direction. But if the hip is not working correctly, we get a lot of wavering side to side, and especially when we're stepping or running, when we go to land on that knee, the natural forces cause that knee to want to cave. But we have a hip muscle called our hip or our glute medius that tries to keep it in alignment and keep it in this range of motion. If that glute med is not efficiently working, I would never say weak, but it's not efficiently working. So when we're running, that muscle is being stretched out. And so it has to work in an eccentric, lengthened position and be able to control that knee further down the chain and the lateral forces of it wanting to cave in. And so we work that glute medius in a stretched position and we get it to be more utilized. That helps with some of the stresses that are on the knee. So then we're working those muscles. We're also working hip range of motion so that our hip can absorb some of those forces when we're landing. And it's not so much of a limitation that our knee has to take up some of those spaces. And then we're always treating the ankle and making sure it's moving in the correct position. If your ankle doesn't dorsiflex very well, basically we have to turn our foot out to try to run or get our knee over our toes to propel ourselves forward. And so if we can get better ankle range of motion, then our knee can track better over our toes and not have to go laterally to create long strides or to create the motion of running or walking. So really cool case. I do believe this person is not done. I believe that we got a lot of work to go ahead, but in the short term, we change a lot of range of motion and we reduce a lot of pain. But I hope that we can get this guy out to running. And I do believe we will. So if you have had a knee replacement and believe that I can't do anything about this knee, or you do just have knee pain and you think that you're headed down that route of a knee replacement, come in. I believe that we can help you with these complaints, and I believe that we can get you back to doing things that you love.